Hi everyone, welcome to Facebook Live. It's Tuesday at 1 o'clock with Dr. Blum for lunch. I welcome you and I'm appreciative that you choose to spend your lunch hour with me. It's not a full hour actually, I'm just going to be here for a half hour. And as you all know, we'll do 15 minutes, I'll talk about a topic, and then I will answer questions. And if you're not available during lunch right now, it's fine because we do take this and post it on our Facebook page, so on my public figure page, it will live there. So you can always go back and see this at your leisure or share it with your friends and let people know about the great topics that we're talking about. So welcome. Happy December. Things are busy in my household. I don't know about you, but I have my adult children all just, moved in for the holidays and definitely busy in my house. But it adds to the festivity, and I'm happy everyone's home. But it does always remind me about my self-care and needing to make sure I take care of myself during this time because it can get really sort of unbalanced. And but that's not the topic for today. As everyone knows, I always send out a survey. We post a survey, and you get the opportunity to tell me what you what you want, a topic that you want to talk about. And for this week, everyone voted. The number one response was for arthritis. And actually, I had put up the topic as rheumatoid arthritis, but since that voted and that came in really high, I actually am going to take the topic and make it a little more broad. And I'm going to open it up to include all forms of arthritis and at least start our discussion here. And it seems that these big topics spill over to the next week, so maybe next week we'll do, it'll be part 2, and we'll see how much we can cover today. This is top of mind for me because I actually just finished, but a month ago I sent in my manuscript. I finished the first draft of the manuscript for my book, Arthritis, which does cover all these topics. And actually the first chapter of the book, the first section of the book is called, What Kind of Arthritis Do I Have? And because there's so much confusion and people get different diagnoses and so I think that demystifying and helping you figure out, what does it mean when you have joint pain? Is that arthritis? What is arthritis? What kinds of arthritis are there? And what are the implications? Is a really important thing. It's so prevalent. Arthritis is actually the number one cause of disability in the U.S. For people who have a disability, arthritis is the number one cause. It frequently, pain, it contributes to chronic pain, deformity. It's actually a very big issue. And so we're going to tackle that. We're going to talk about that today. So let's first, so I'm going to slow down a little. I speak so quickly because it's my natural way. I am from New York after all. I'm a Long Island girl from my roots. But I also feel like there's so much to talk about and not a lot of time. So I'm always sort of rushing to get get everything in. But as I slow it down just a little, let's circle back and start at the top. So let's just understand, what does the word arthritis even mean? So arthritis is an itis. An itis is when there's inflammation somewhere, okay? And so has to do with the joints. So it refers to joints. So it's really just inflammation in the joints. Now, to be a true arthritis, you actually have to have pain and swelling in one of your joints. And it's not, so an itis, inflammation, is pain, swelling, redness, heat. Those are the 4 definitions of arthritis, of an itis, to be called inflammation. And so to have arthritis, you actually have to have, you really want to have pain and swelling, and maybe feel warmth and red, but certainly pain and swelling in the joint. And sometimes you might find that your joint hurts a little bit. And I have that sometimes when I eat too many nuts. I'll notice, and it used to happen with almonds, but I rested myself for about 6 months of not eating any almonds, and now I can eat them again in lower amounts. But what I got was it was actually in this finger. I'd feel like a little sore in the joint. And I said, oh, I have arthritis. But it's really not arthritis. It's really an arthralgia, because it's just a little pain and soreness in the joint, but there was no inflammation or swell. I'm saying inflammation. There was no redness and there was no swelling. The joint didn't swell up. So to be truly arthritis, you need to have pain and swelling. The swelling is important, and redness and heat. So if you develop, so then you start thinking, okay, I might have that. And so there are many joints in the body. There's the joints in your hands, there's the joints in your wrists, elbows, shoulders, the large joints, and then there's the small joints. So shoulders, hips, knees are larger joints, toes and fingers are the smaller joints. And depending on which joints, where you find the arthritis, sometimes determines what kind of arthritis you have. And so we'll come back to that in a sec. So sometimes arthritis, so let's just talk about the general types of arthritis as a way to sort of narrow in what we want to talk about. Because we'll focus in a little on RA today, and maybe next week we'll talk about osteoarthritis or whatever we haven't spoken about. So you can see on our board, and I'm so proud, thank you Sarah, she really set me up better. This week we figured out, this is not reverse right now, we figured out how to set ourselves up. I put up here the different kinds of arthritis. So the first kind of arthritis is called inflammatory arthritis. Inflammatory generally refers to arthritis that's due to things like autoimmune disease. There's one category I didn't put in there, which is arthritis from other rheumatic diseases. So what's under this inflammatory umbrella, inflammatory arthritis, are the autoimmune diseases, rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, and actually PSA and AS, or psoriatic and ankylosing spondylitis, those are both considered spondyloarthritises. And one of the reasons is spondyle means sort of the back and the spine, and those arthritises have back pain, and arthritis in the back is a very clear feature of that, whereas rheumatoid arthritis does not have the back involved, typically, and more about the small fingers of the hands and feet. Right, so location matters, and we make a diagnosis sometimes based on location. We make a diagnosis of those also based upon blood tests, and we'll come back to that. I want to stick with my general overview. So the first thing is then, those three categories are the most prevalent. Rheumatoid arthritis is the most prevalent, psoriatic comes next, and ankylosing spondylitis comes next. Then there's a category called undifferentiated inflammatory arthritis, and these are the people, you might have gone to the doctor and they said, well, your blood tests are all normal, but you're going to have RA someday. We're going to call you early rheumatoid arthritis or early undifferentiated. It just means that your pattern of your arthritis looks like you're going to end up with rheumatoid arthritis, but you don't have the blood tests yet that are positive, so you're given this diagnosis of either early RA or undifferentiated arthritis, and it really is basically the doctor throwing up their hands and saying, this is inflammatory, but you don't have anything yet. We can't give you a definite diagnosis. And in fact, we don't really know what to do with you. And sometimes people are given medication for this. And I have people that'll come into my office and say, my blood tests are all normal, but I have swelling and pain in 3 of my fingers, and my doctor, and maybe my wrist or something like that. But there's a clinical picture that looks like it's going to be a rheumatoid arthritis, so my doctor wants to treat me for RA. And that's basically the way conventional medicine handles this category. From my perspective, functional medicine, and this is me here rooting for functional medicine and the sort of integrative functional approach to managing arthritis, which is hands down far ahead of any other approach to treating, any conventional approach to treating arthritis. Because how does your doctor treat arthritis? We give you immune suppressing drugs. We give you, in this whole category of arthritis, you get treated with medication to shut off your immune system and to shut down the inflammation rather than trying to treat the root cause. And because you've been watching me, I hope for a little while now, you know that, and hopefully you are seeing your own functional medicine practitioner, and this is the way you treat your own health. But the goal is always to find the cause and treat that. Don't just treat the symptoms. And so conventional medicine approach is really to treat the symptoms and to try to just help you feel better. And so undifferentiated arthritis, being so early, gets the same basket of drugs thrown at it. Where wouldn't it be great if you just used the functional medicine approach and treated the early arthritis by healing the gut, by changing what you eat, by using powerful anti-inflammatory herbs to shut off the inflammation at the root, by managing stress, things like that, addressing trauma, but healing the gut it turns out, is the number one thing that's connected with arthritis. And we'll come back to that too. But now I still want to get through today my goal is just to give you an outline to help you understand the different kinds. And so that's the inflammatory autoimmune arthritis that are specifically arthritis conditions. The one that I forgot to write down there is arthritis from rheumatic diseases. So lupus, Sjogren's syndrome, mostly those two, but even people with, polymyositis, dermatomyositis, or scleroderma, they can have all the ANA positive autoimmune diseases. You can have arthritis too, and that's called arthritis from rheumatic disease. And so even if you end up with arthritis from that condition and it's not primary arthritis, it still suggests that a leaky gut is at the root cause of your problems. So inflammatory arthritis as a whole, when you think of inflammatory arthritis, if that's what you have, you must heal your gut as the number one thing you do, and we're going to come back to that. Gout is up there as one of because it triggers inflammation. Gout are crystals that land in the joint and trigger inflammation. So it is considered an inflammatory arthritis, but it's not in the world of autoimmunity. But it is considered inflammatory, so I put up there. The next big category that needs its own section in my book, which it has, and which is a different discussion somewhat, is osteoarthritis. And so that, I think we'll put that up as a separate discussion maybe next week or the week after. This will probably be a series that we'll end up talking about because I wrote a whole book on it after all, so there's a lot to talk about. But osteoarthritis is when there's damage to the joint comes first, and then the inflammation and pain sort of come afterwards. But osteoarthritis, so it's not a primary inflammatory disease, it's more triggered by injury. This is always thought to be old age, right? But it was so interesting when I went through the literature and really read more about osteoarthritis. It turns out that yes, injury, overuse, repetitive use, athletes, occupational, people who squat a lot in their hips, there are people, it increases your risk of osteoarthritis, absolutely. After injury, you're at an increased risk of getting arthritis in that joint, absolutely. But it turns out that the number one risk factor for osteoarthritis is obesity. And it's not just the weight. We always thought it was the weight, but it turns out that it's actually the fat cells and the inflammatory fat, the inflammation coming out of the fat cells in the body, that are the metabolic syndrome, the metabolic problems, the what we call leptin resistance, the whole hormones of being over fat, the VAT, visceral adipose tissue. That metabolic syndrome, obesity, visceral adipose tissue, metabolic syndrome, hypertension, that whole thing causes and triggers inflammation in your joints. And so osteoarthritis is actually a metabolic disease. And so helping people lose weight, helping reduce body fat, helping eat food and diet and lifestyle is so important. So you might have had damage to that joint from an injury, but you don't have to have inflammation and pain. What drives the inflammation and pain, it turns out, is the metabolic derangement, the metabolic issues in your body. So the root cause of treating osteoarthritis has to do with metabolic. And the other piece to that, though, bringing it even further, which goes to the gut, is that there's a lot of research now linking gut and dysbiosis, which we've talked about, leaky gut, but certainly imbalance in the gut microbiome, as driving obesity and driving metabolic syndrome. And so therefore, in addition to helping people with their metabolic and helping you understand that you have to reduce your body fat and reduce the inflammation coming from the food you're eating and from the weight in your body, you also have to make sure your gut is healthy, because that's one of the ways you're going to help reduce body fat and help your body come into better metabolic balance. So there is still a gut connection for osteoarthritis, but the metabolic syndrome and obesity is key. And again, it's not just about losing weight, it's also about addressing inflammatory fat. So osteoarthritis, the way you know if you have osteoarthritis is you get an x-ray. You get an x-ray of your hands, and the radiologist and your doctor can read the x-ray and tell you if it looks like there's a certain pattern that looks like rheumatoid arthritis and there's a certain pattern that looks like osteoarthritis. And x-rays are the best way to differentiate the two if your doctor can't really tell by looking at it. Okay? And if you know you had an injury in that joint, it's possible to develop RA in a joint that you can have a combination. So sometimes you can have both going on at the same time. So you can end up with osteoarthritis and rheumatoid arthritis in the same joint. So thus the need to have a specialist help you figure it out. And last but not least today, how am I doing on time?
We got about a minute left.
Okay.
There's not really any questions, so you can keep going.
Okay, good. So, infections. So then there's infections, and I live in New York in the Northeast, and I was going to say it's Lyme disease is epidemic here, and I was going to we're not unique. We used to say we have the epidemic, but you know what? It's now all over the country, and it's all over the world, and this is not unique to where we live. And so so there are all sorts of ways you can develop arthritis from infections. And so infections like Lyme, and there are also viruses like parvovirus that can cause acute arthritis symptoms. And so the hallmark of having an infection, viruses usually only last, like if you've had the arthritis longer than 6 weeks, it's probably not a virus. If it comes and goes within 6 weeks and you had a viral illness that went along with it, then it could be a virus. Lyme disease can last longer, and the arthritis could settle in for the long run. So you definitely need a doctor to help you figure out if this is Lyme or not, and that is a huge confounder, in the whole process. Okay, so I'm going to take a pause for a second, and just sort of take a look at what I think people might be the most interested in knowing next. So actually, maybe we'll just talk about rheumatoid arthritis because that is what was the winner on our survey. So a few minutes about rheumatoid arthritis. It is the most common form of inflammatory arthritis. And if anyone has questions about osteoarthritis, we could talk about that today as well. But rheumatoid arthritis is really a scary illness for a lot of people because it progresses. Rheumatoid arthritis can progress to really disabling deformity in the hands, and feet. You could really have very mangled. You can really get destruction of the joints, which can cause real disability, and it can move quickly. So sometimes that's why conventional doctors get so stressed and up in arms about if you have a rheumatoid arthritis diagnosis and they want you to go on medication right away, because they're concerned that this is going to hurry up and progress really quickly to deformity and destruction of your joint that's not reversible. And I agree with that and the need to treat it really quickly. If you have arthritis, it's a new inflammatory swelling in your finger or toes or feet or hands or wrists. We want to get that treated as soon as possible because we don't want your joints to get damaged and destroyed. That's irreversible because the joint itself, the arthritis, is reversible, but the destruction's not. So making the diagnosis is really important. And how do you make the diagnosis for rheumatoid arthritis? The first thing is you'll go to your doctor, and you can go to a generalist or internist, but they'll sometimes send you to a rheumatologist, and they will look at you and they will look at your the pattern in your hands and feet. How many joints are involved. You really need to have fingers and toes in some form involved for it to be rheumatoid arthritis. They might send you for x-rays to take a look at what the joint looks like and to assess how much damage might be there already. And so usually there's some sort of imaging that happens, whether and x-rays are usually the number one thing that's done. And then our blood tests. And the most important blood tests for rheumatoid arthritis are 2 antibody tests. One's called rheumatoid factor, and the other one is called CCP, which is it's a citrullinated peptide antibody. And what that means, it's an antibody test. Anybody can run it. Your internist could run it as a screening. You don't need a rheumatologist to do that test. I do it on everybody that walks in my office who has arthritis. I run an RA and an RF and a CCP on them. The other tests to do are something called a SED rate and a CRP, which are both just markers for inflammation, to try to get a sense of how much inflammation is running amok in your body. And with those tests, you can make a diagnosis. Now, if all those tests are normal, then this is not rheumatoid arthritis. I was going to say not yet. It's not rheumatoid arthritis, or it's very early rheumatoid arthritis, which is, and now is the time to turn that chip around. Okay? And so, but if all of those blood tests are normal, then you want to go ahead and start looking for other things. So you want to check your uric acid crystal. Well, actually, depending on where it is, gout is very symptomatic. If you get it in your foot, there's certain joints that are involved, most frequently the big toe. If it's in your fingers, it's not going to be gout. But for rheumatoid arthritis, you want to do those 4. And if those are normal, but none of these other tests are positive, then, and it doesn't look like osteoarthritis on the x-ray, and it doesn't look like you have any infections, then it could be this early RA, and that's the perfect time to do treatment. And so what do we do for people with RA? The first thing that we always do with anybody with any inflammation in the body is go on an anti-inflammatory diet. And we talked about that a lot in previous posts. I'm not going to get into that today, but it's an anti-inflammatory diet. It's definitely an elimination diet with the removal of nightshade vegetables. And that's sort of the new thing for today in terms of arthritis diet, is that nightshades, tomato, potato, eggplant, and peppers are the number one, are not number one, sorry, that was sort of rote that came out of me. But tomatoes, potato, eggplant, and peppers are nightshade vegetables. And nightshade vegetables are known to have compounds in them that trigger joint pain. And so I always take all my arthritis people off of the basic elimination diet, which is gluten, dairy, soy, corn, eggs, sugar, alcohol, caffeine. We do that whole elimination diet at first, clean it up, bring in all the good, healthy, anti-inflammatory foods, whole foods, get away from processed foods, and take out the nightshade vegetables. And that's usually where I start with my arthritis patients. But you want to do that, and you want to see, because if you have arthritis, you definitely have a leaky gut. And if you have a leaky gut, that means that you are having food sensitivities, because if you have a leaky gut, it increases your risk of food sensitivity, so you definitely have some foods that are triggering your arthritis. And so the goal really is to figure out what those foods are in a temporary way, remove them so that you can feel better. We heal your gut, and then you can eat those foods again. Okay?
There's a question.
Okay. So pause for now. Let's see if there are any questions. Go ahead.
What is temporal arthritis?
Temporal, maybe you mean temporal arteritis?
Arteritis.
Yeah, okay. So the question was about temporal arteritis. And arteritis is an inflammation in the artery. So your temporal region of your head is over here. Your temporal, and you have your temporal mandibular joint is here, your TMJ. And this is the temporal region of your skull. And so there's an artery that runs up. I'm giving you a demo. But there's an artery that runs up through here. Now, so there's an inflammation in those arteries. Now, arteritis, it's just, so the teaching point here is that itis can strike any tissue of your body. You can have an itis of your artery, which then you have arteritis. You can have an inflammation of your muscle, and then you have a myositis, itis. You can, so you with me there? So all these things you can end up with. You can have itises, right? Inflammation in your colon. You have colitis. So temporal arteritis is an arteritis in the temporal artery, and sometimes it's associated with autoimmunity, and sometimes it's not. And so it's not always in terms of the causative factors. So when you have any itis in your body, the treatment of an itis is sort of what I talk about in the Immune System Recovery Plan, because my first book, the Immune System Recovery Plan, is all about repairing the immune system and reducing inflammation. It's finding the root causes of inflammation and treating the root causes. And the root causes of all inflammation in the body are food, stress, gut, healing the gut, dysbiosis, and toxins. And then number 5 is also infections. And really, so there are 5 causes of really itises in the body, and infections would be number 5. But a lot of infections you can't find and treat, so we really work on healing the immune system with steps 1 through 4, and then, and then treating infections as we find them for sure. So that's what temporal arteritis is. And you should follow the same plan, as anybody with any other kind of inflammatory condition. anti-inflammatory diet, do an elimination diet. Make sure your gut is healthy. And 70% of your immune system's in the gut, so you want to heal your gut and reduce the inflammation that's coming out of that. If you need help healing your gut, I have a freestanding Heal Your Gut program on blumhealthmd.com, and I can help you do that. And then certainly stress, of which, I'm really a mind-body medicine practitioner myself. Managing stress better, understanding stress, reducing how stress comes into your body, and then making sure you look at the toxin load that you have in your body. And I talk about all those steps in my book. So I would send you there to work on the temporal arthritis. Okay? Okay, so let's see if there's anything else that I can neatly finish up today, because we're coming to the end of our time together. And I don't think I'm going to start on any of these. I think we'll just sort of finish up in terms of rheumatoid arthritis. If you think you have, a swelling and pain in any one of your fingers, you should go to your doctor and have it evaluated. You really need to, because you need to know if you have rheumatoid arthritis. Because if you do, you need to do something about it soon, quickly, because it can be disabling and damaging to the joints. You should make sure your doctor tests you. I'm just sort of summarizing now. You should make sure your doctor tests you for rheumatoid factor, RF, CCP antibodies, an ESR, which is a sed rate, and a CRP, which is an inflammation marker. Get those tests done, and then you're going to figure out if you have RA. And if you do, my arthritis book comes out next fall, but for now you can go to my first book, Immune System Recovery Plan. Follow steps 1, 2, and 3. Heal your gut. You don't need those medications to turn the ship around. You can do it with functional medicine, okay? Functional medicine offers you the best chance of curing it, of treating the cause, treating the root, and avoiding those medications that just treat the symptoms, okay? So I'm going to leave it at that. We can continue with OA next week or move on to another topic. We'll see. We'll put that up and see what everybody wants me to talk about. Have a great, drive safely. Holiday party. This is holiday party week. So I'll leave you with drive safe, be safe on the road, just be mindful as you go through your holiday party and holiday time. And I'll talk to you all next week. Okay?